I'm going to go over clinical chronological protocol, which is something that we learned extensively in dental school. And when we are first new into dentistry, unfortunately, we kind of can mess up some of these steps. And I equate the clinical chronological protocol to very similarly to building a house, where if we don't create a good foundation for our dentistry, the other things that we do just don't end up working. So very similar to a house that may need or looks like it needs new windows because there's some cracks in them. Well, if we don't look to see if the foundation is secure, then putting on new windows isn't going to really help our issues. So as I've matured in my career, what I've found is that I'm very sequential in how I address patients, and even if they come in with something that looks complicated, if I break up the sequence into very specific things, then I always can get the same result, which is a house with a good foundation, and I know that the windows or my dentistry is going to be as good as it can possibly be. So it's really important that we follow these sequences. We don't violate the chronological protocol, which I see a lot happening with younger dentists or dentists who are thinking more about short-term production versus long-term comprehensive patients. So really kind of study these and create the appointments that you need to set yourself up for success. So if we go through these things, you're going to see that they make total sense. It's exactly what we've been taught in dental school, but it's something to always be reviewing. One of the very, very top things that I would say are the practice builders is to create comprehensive patients, that we have a huge emphasis on them coming in for the best dentistry that we can do, which is their hygiene visits, okay? So the first item here is addressing any pain, infection, or chief complaint. Again, a patient that comes in for an emergency, it is absolutely fine to address even an anterior chip on tooth number 9 before we take care of, let's say, unresolved infection that is not their chief complaint. Now, if they come in obviously with an abscess and that's their chief complaint, yes, let's go ahead and address it. So first thing is to try to address their chief complaint, their infection, as quickly as possible and come to a final resolution as quickly as possible, either through a root canal, extraction, whatever it is, so that we can get them back to do a comprehensive oral exam. Now, when we do a comprehensive oral exam, it's going to happen in one of two visits initially, which is a hygiene, new patient hygiene, which is a patient who had come in for a chief complaint. We addressed it, and now they're coming in for their hygiene visit and their comprehensive oral exam. Or if they had initially asked for a cleaning at their initial visit, we will schedule them for a hygiene prophy adult new patient, okay? So all comprehensive exams need to follow the read-over technique, and we need to go tooth by tooth, and we need to do the intraoral and extraoral exams. But it's very important that we chart every single existing tooth, the proposed dentistry, and that we also complete a periodontal chart. Okay, so essentially no dentistry should be done beyond number 1 until we have treatment planned and done a comprehensive oral exam. A lot of times what I'm going to see is, let's say a root canal is done on the first visit, and then the next visit is potentially a crown on that tooth. That is out of sequence because we don't know if there's another infection that is more important than that crown. Or sometimes what I'll see is a SRP being done on the first visit without having a larger plan of, do we need to get teeth out in that quadrant before we do the SRP? I think another common one would be a crown that is prepped without taking care of the caries on the adjacent teeth. So those are some of the common ones, but it's kind of a glaring thing for experienced dentists to see younger doctors going out of sequence. It's exactly like seeing a younger construction worker going in there and repairing a window without them checking to make sure that the foundation is working. So again, make sure that we address any chief complaint, then really emphasize the comprehensive oral exam. If you've done the root canal, the next thing should be the comprehensive oral exam. If you've done a localized SRP to try to get them out of pain, the next thing should be the comprehensive oral exam. Okay? So after we've done the comprehensive oral exam, obviously we want to remove all unrestorable teeth and root tips. Again, I've seen this very many times where a newer dentist will be doing a cleaning or even a crown around unrestorable teeth, and it just makes everything super hard, and you're not able to clean up as well if you had taken out those unrestorable teeth. And again, it's a little bit maturity, but you really need to be patient's best friend and a true doctor and say, hey, Frank, I know that this isn't like your chief complaint. I know that you don't really like the idea of getting this tooth out, but we really want to work on creating your best dentition, which is, let's start off by getting rid of that tooth. I'm going to make it super simple. We're going to let it heal, and then we're going to come in and do the next steps. So again, remove all those unrestorable teeth and root tips, and then we're going to endodontically treat any SIP-SAP or necrosis. So symptomatic irreversible pulpitis with symptomatic apical periodontitis or necrosis that we may probably see on the x-ray. Okay. The next thing would be to remove all symptomatic wisdom teeth. Now, obviously, not every patient is going to have every one of these issues, and so you could definitely be skipping all the way to, honestly, step number 17, 18, 19, all in one visit if they don't have any of these. But anyway, if someone did have all of these, then you would remove all symptomatic wisdom teeth. Then we would want to address any periodontal issues through scaling and root planing or prophylactic cleaning. Okay. We would also want to, I would also emphasize up here on removing unrestorable teeth and root tips is to offer bone grafts where appropriate, okay, which is honestly becoming more and more, just because even on the backside or when wisdom teeth are extracted, it may be appropriate to offer a bone graft there so that you don't get periodontal disease on the backside of the second molar. So we'll remove all symptomatic wisdom teeth. We'll address periodontal issues through scaling and root planing or a prophylactic cleaning. And then we'll restore deep caries, okay? And a lot of times, sometimes what happens is if you have a patient that doesn't have a lot of large issues, but just kind of has some medium issues, and we're trying to play the insurance game, we might restore deep caries this year, and then we might do shallow caries next year. So again, there's multiple reasons why you want to make sure that you're following this so that we can attack the biggest issues first. Okay, so then we're going to then we're going to restore caries next to crowns. Again, I've seen this being violated where a crown impression is being taken and the adjacent tooth or the interproximal contact has caries on it. So make sure you restore the caries next to the crowns. I usually actually just do it on the same appointment. I'm going to look at every single adjacent tooth at the same time, and then I'm going to crown broken or cracked teeth. Then we're going to restore shallow caries. Then we're going to treat the non-carious cervical lesions or the abstraction lesions. Then we're going to address cosmetic concerns, including whitening. Now that our teeth are whitened, then we can start adding in or start building more teeth that the patient may want. So then we'll place prosthetic required implants. So if we're going to have a partial around an implant tooth, obviously we should make that tooth before we make the partial. And then we'll provide removable prosthetics. And then, depending if the patient needs or does not need those prosthetics, we'll place implants and restore non-prosthetic required implants. And then after all of the dentition is basically restored, then we'll provide occlusal splints and night guards. There's nothing more frustrating than taking an impression for an occlusal guard and then finding out, oh shoot, I needed a crown. Then you place the crown after the night guard's been done, and then you have to retrofit the night guard, okay? And then again, like we've emphasized from the beginning and all the time, ensure that there's a consistent recall established using the following appointment types, which is the prophy adult or the perio maintenance. And these appointment types should be, or these appointments should be verified as scheduled using the routing sheets or the new blue dots on every appointment, and we should do that at every appointment, okay? And then when they come back for their recall, we should do a periodic evaluation or periodontic evaluation for unresolved periodontitis. And if we are not getting any resolution, that would be an indication that maybe they need to go and see a periodontist, okay? Now that we have their dentition pretty much all taken care of, we should send them to an orthodontic evaluation. Again, we're not going to send them to an orthodontic evaluation unless we have all of their dentition cleaned up. In fact, the orthodontist does not want to be placing braces on teeth that have caries and things like that. And they don't want to be doing orthodontics on someone who has unresolved periodontitis, okay? And then finally, after they come back from ortho, if you and the orthodontist have talked and discussed the case, then you would place the post-orthodontic cosmetics such as veneers. That especially happens for patients that are going to need implants, and then also patients that maybe need like a peg lateral veneer or something like that. So anyway, be super religious on following this clinical chronological protocol, and you will create lifelong patients because you will have really made friends with them and solved all of their issues in a way that makes sense to them, and they will be appreciative that you have helped them build a house that is not going to have roof leaks, that's not going to have windows breaking, that's not going to have cracks in the drywall. It's just going to be as solid as it can be, and then they will send all of their friends because you are one of those people that can see the end from the beginning.